Welcome to the Ohio Adult Allies Podcast Season 2, where we are developing, inspiring, and empowering youth leaders. In today's show, we discuss building relationships with school districts to collect OHYES data.
Hello, everyone. I'm Holly Raffel, and I'm excited to be here today for another episode of the Ohio Adult Allies Podcast. I am lucky to be here today with Laura Bellison from the Ohio Department of Mental Health and Addiction Services and Eddie Neal from Lawrence County's Impact Prevention. For those of you who haven't met me before, I work at Ohio University's Voinovich School of Leadership and Public Service. I started my career in youth-led prevention, believe it or not, when I was in high school in the late 80s, early 90s. So I can truly say that I didn't choose youth-led prevention. It definitely chose me. Laura, can you tell us a little bit about your background? We're so glad you're here today.
Thank you, Dr. Raffel. I've been working for Ohio MHAS for quite a while, and prior to that, I'm working on behalf of adolescents for many years. But I've been with the prevention office at Ohio MHAS for about 8 years, first with the Safe Schools Healthy Students grant, and then next on the OHYES survey. And it's been a really exciting adventure.
Thank you so much, Laura. Eddie, can you tell us a little bit about yourself and where you work down in Lawrence County?
Yeah, so born and raised here in Lawrence County, Ohio. I came into the prevention field in 2018 and worked primarily starting out in youth-led prevention, and then started building rapport and relationships with schools. So take on some additional responsibilities in helping with the OHYES survey, a little bit of coalition work, and have kind of transitioned into a public relations position, and also doing trainings for the Botman life skills here with Impact Prevention.
Well, thank you and welcome, Dr. Bellison and Eddie. We're so glad to have you here today as we talk about collecting data with the OHYES. So my first question is for you, Dr. Bellison. What is the OHYES?
We love the acronym, but it actually stands for Ohio Healthy Youth Environments Survey. And it's a web-based survey that measures risk and environmental factors that impact youth health and safety. The survey actually gathers information on issues such as substance use, mental health and suicide, physical health and well-being, adverse childhood experiences, safety and violence, and family, peer, and community factors, things like school climate as well. We're excited that we're available for all Ohio schools, both public and private, and for use with students in 7th through 12th grades. It's entirely voluntary for schools to participate, and the thing that we love is that we make it free for the schools to use.
Thanks, Laura. We really appreciate the background on the OHYES, but my next question is also for you. So how do you collect all that data from young people in Ohio?
Well, last year we collected data from probably about 30 to 40,000 students. So it was pretty exciting. Ohio MHAS actually administers the survey. It's actually a partnership between the Ohio Department of Education and the Ohio Department of Health, but Ohio MHAS administers it. We actually have a partnership with the schools at the local level because the superintendents and principals actually register their schools with Ohio MHAS to participate. So schools select the grades they want to survey and when they want to survey. So we have a lot of school flexibility built in. My role at Ohio MHAS, I coordinate with those schools to register them. And then I also send out the planning and administration instructions to the principals and the school staff who help coordinate the survey, because the school is actually the one that administers the survey. I have been told that we are very easy to administer, and I think one of the reasons is that we try to provide a lot of supports to those schools to help them do that. For example, we have a manual for schools and we have videos on our website. And we send out instructions and documents and forms such as our parent notification that schools can customize and send out to let parents in their areas know that they're going to be doing the survey. And then we also send out a script for them to read to their students when they give the survey. And it's pretty simple. Students enter in the web address for the survey on their computer or tablet and a school level ID number to take the survey. And then as they move through the survey, all their responses are saved on our Ohio MHAS server, and no students are individually identifiable and the information is protected.
Thank you so much for that detailed information, Dr. Belston. Really appreciate how thorough you were. It sounds to me like, though, even the community members can really want the survey. It's really up to schools and superintendents as to whether or not the survey actually gets administered. So when would you select community members and agencies and organizations start reaching out to schools to make that connection in order for their students to have an opportunity to give voice on those issues that matter to them most?
Thanks. Actually, we have found that the most effective way that the OHYES survey runs is to have partners in the community. We found that community organizations and their members and stakeholders really need to become champions for advocating for the schools in their area to participate. As they advocate with their schools, it, like you said, it does allow young people to have a voice to share what they are doing, what's happening in their community and their lives with what's going on with the schools, and allows the community members to know that information as well, because oftentimes students don't have access to share what they think and what's going on with the community. So parents and community organizations, if they support the youth voice by becoming OHYES champions. And then being a champion shows the youth that there are adults that care about them and the issues that affect their lives and want to help them have some better opportunities. And one of the reasons is Ohio MHAS has very limited capacity to be able to connect with each local community. And so we heavily rely on a variety of our community organizations that may be interested in all of these issues. For example, that may be the local Alcohol, Drug Abuse, and Mental Health Services Board, or a local prevention agency, a local coalition, a local youth-led group, for example, local health departments. There's a lot of people that want to find out what you think and how to help them. And one of the first ways to do that is to build upon existing relationships that the schools have with community members, and then that will increase the ability to forge new relationships and partners. And one of the examples of that is Eddie Neal and the work that he and Impact Prevention have done in Lawrence County. They've been very effective in establishing the relationships among lots of different community partners and really showing the school how impact prevention can help the school and how the survey can help both of them. And I'd like to ask Eddie, so Eddie, what are some of your strategies in building those relationships with the schools that you have used?
Yeah, thanks, Laura, for all that information. I think something that's important to understand is, as Laura was saying, that in their position, they may not have a pulse on each local community. So I think it's very important to have somebody within that local community, within that county, to understand, how to reach out to those schools. What are their needs? What are those prior relationships? And I think, I worked in youth ministry, I've volunteered in the community in different sporting capacities and different church capacities, and having those prior relationships, those connections, and then just being real with people, I think is hugely important. Being open, being honest, and sharing what a great resource that this student survey is to actually see what are our students reporting. How do we better serve their needs? You know, we can throw all these arrows at all these different targets, but if we don't know what our students are reporting, what are they experiencing? And, you know, something that I have found very valuable is echoing what Laura already stated is it is super easy on the schools when they have that community partner. Laura and her team do a fabulous job of supporting. And then us just being that community liaison of saying, all right, what are your needs? How can we address those needs? How can we help you? And then also just heralding the message of how our youth-led prevention teams, our community coalitions, our prevention agency has benefited and really served the community at large and the youth in those schools through this data that is collected. So I think just heralding that message, sharing that out, using some of those connections is very important.
Thank you so much, Eddie. And can you just talk for a minute how you connect? Like, are you just firing off emails, or what do those connections look like? Because I know our listeners really want to know, what does it take to build those strong connections that you've worked so hard to build in Lawrence County?
Yeah, so I started out by an email directory and looking, you know, at those superintendents list and maybe not knowing them and shooting out emails. Did not get much results from that, whether it went to spam, whether it went to junk folder, or they just was inundated with emails. So in some instances that email blast may work, but what I started to do was really use those existing relationships, somebody that I knew within that school district, and say, hey, here's this great resource, here's something we want to offer your school. How can we get in? What's the access point there? And that may be a guidance counselor, that may be a superintendent, that may be an administrator. And just to try to get that crack in that door, just saying, hey, give me an opportunity at your district leadership team meeting, give me an opportunity at a superintendent meeting, give me just 5 minutes to let you know what great benefit this is. And then I don't approach it from the standpoint of what I'm wanting from you. I always approach those conversations of how can this benefit you? What's in it for them? So I want to propose to them the benefits to them, and then work down of how it benefits the students, how it benefits the community, and how we can partner in those relationships.
Absolutely. Thank you so much, Eddie. And I'm familiar with your work, obviously, because we worked with you all in Lawrence County for several years. And I know that you also moved to a MOU, or a Memorandum of Understanding, with your district. So can you tell how this process sort of evolved from these conversations to actually having a formal commitment from these districts to collect the data?
Sure, yeah. When I started with the agency back in 2018, we was having surveys in 3 of our districts. We have 7 public districts, a technical, a STEM, and a private Catholic school. And only 3 of those districts were participating, and we were only doing prevention services in those 3 districts with no other representation, no other answer from any other districts. It was kind of a closed door there. So I'm really a personally driven kind of personality and goal oriented. Some say I'm a hair competitive as well, but I just set a goal and I said, hey, by the end of next year, I want in every district. And the situation was we started collecting these MOUs in the summertime. And Molly comes to me and she's like, hey, we have this partnership with OU and we're collecting this data for this grant and we need more schools on board. We need this by the start of the school year. I'm like, Molly, it's the summertime. I can't get a hold of anybody. So they're not answering emails. They're not answering the board office. So I just go knocking on doors and start getting those relationships built. And the year later, we was able to actually collect from all 10 districts. And how that works is we have them signed a memorandum of understanding with us and Ohio University that OHYES would partner with us, and we would get those building level reports to them. and just really echoing how important it is that they have that building level information, how they can break that down by grade, and how that we can help them. We really use that in our youth-led prevention teams. And as I would ask for their agreement in that, echoing the benefit to their students, that peer-to-peer mentorship. Holly knows how important that youth-led prevention piece really is across the state. And we've been effective in youth-led prevention, and I just want them to know what great benefit that is, and just letting them feel comfortable, letting them know how that we're here to partner with them, we're here to support them, we're here to help them, take a little bit of that load off of them. And you know, as Laura said earlier, if there's ever anything that we can't answer, her and her team are awesome at jumping right in and meeting the needs of those superintendents, those school districts.
Absolutely. Thank you so much, Eddie, for sharing, kind of the what's in it for me for those school superintendents and principals down in Lawrence County. Laura, you work with schools all over the state of Ohio. What are some other benefits of OHYES that you've seen other communities really value?
Thanks. It's been great to work with Eddie and see the impact that they've been able to have in their community and offer their schools some additional programming. One of the things is that the survey results can really provide needed information to help schools understand maybe what's going on with students that they don't see in the school nurse's office or in the school counselor's office. So it really gives them a whole picture of what's going on so they can plan for their own programming, for example, in their positive behavioral interventions and supports. And ultimately, that makes the entire community safer and healthier when the schools have that information and can make adjustments to meet their students' needs. And then, as Eddie said, these data can help strengthen partnerships, not only between the school and like the prevention organization, but also through partnerships with other local agencies or treatment providers, whether they're mental health or substance use providers. Local health boards, for example, to meet their community planning needs, and then to support the planning and programs that are going on in the school with things that are going on in the community. Also partner with law enforcement to help kind of understand what the community's larger needs are. And so really that ultimately will then have a collective impact on community health and well-being. And those partnerships that exist through using that data together really translate into working better across the board and helping meet the entire needs of the community and where they're at, and do that wraparound support and planning to raise the entire community. Another thing that the survey does is, for example, Eddie's group has been able to look at the survey over multiple years. And so it helps them measure the impact of their efforts over time. The OHYES can be done up to annually by a school. And so over time, they can see how effective their changes are being, and then also maybe assess, for example, how COVID has impacted their students, for example. Another way community organizations use the information is not only for programming, but for community level planning and meeting accreditation requirements. Because I know, for example, community health boards are required to include youth surveys in their community planning and accreditation needs. And then the other exciting thing is community organizations can use this data to write proposals for foundations, for federal or state governments, or I know an example of one community that has used the data with their local United Way to support requests for additional resources. And then also one has used with levy dollars to determine how they're going to use their levy dollars in what capacity in the school system. And then finally, one of the ways that Eddie's been involved is with federal and state grants. So they've had some grants through the Federal Substance Abuse and Mental Health Services Administration that requires data collection. And the OES includes the items that are often required for those data collection requirements. And so it lets communities really bring in additional resources for additional programming and planning to meet their students' needs over time.
Thank you so much, Laura. Eddie and Laura, we've talked a lot about the benefits of the OES, but with every benefit, there comes some challenges. Eddie, what challenges have you run into down your way with the OES?
Yeah, I think one challenge is, on the onset, superintendents, school personnel are inundated with every agency, every entity, do this, buy this, try this. And I think just getting past just another initiative or another program or another offering and really getting down to the meat of how it's beneficial. I was invited just this morning to another county's superintendent meeting, and they was going down through the list of all their state requirements, and they had the treasurer in there, and they had all these different agencies in there, and it's just like bam, bam, bam. And so you get this short amount of time to really show them, hey, here's what benefit it is to you. So I think just getting that initial crack in the door, that initial opening, and then really putting forth the information of, hey, this has been beneficial in these counties across the state, and here's how different health departments and different agencies and different prevention services, different youth-led programs have used this. One thing I talked to them about this morning was they do multiple different surveys throughout the county, and they're getting different answers to different questions. Some of those are important, some of those are helpful, but to streamline that process and to have one universal survey across all the districts for one county has proven to be hugely impactful, that we can look at one district compared to the other district and that countywide versus the statewide. You have to have 3 districts to participate in a county to get that countywide report. So if just 1 or 2 districts are participating, they may get that information, but it's not available there to the county and helpful beyond that. So, and I think just getting past that, that order of, hey, this is just another offering. And I think putting a local face to that, as Laura was talking about, other coalitions and even the OES administration have sent out opportunities, and maybe they won't get the same opportunity as some other champion within that community. I think that's what's proven effective in Lawrence County is not only her work that she's doing of pushing it out from the top end, but us working in the grassroots efforts of putting a local face, a local feel of saying, hey, just give me that few minutes, give me that opportunity to be there. And then lastly, I think just being real and honest with people is so important. And, just showing them, hey, there's a rise in mental health. There's a rise in anxiety. There's a rise in depression. There's a rise in suicide attempts across our county. We've come off of a very tough year, and we want to benefit the kids as much as possible. And I think there again, that is an opportunity, but it's also a challenge because there's all these offerings, there's all these services, there's all these people lined up at the doors. So just getting in that initial opportunity and then really pushing forward in that, I think is important.
Absolutely. Thank you so much for providing that realistic picture to us, Eddie. It really means a lot. Laura, what would you say to folks who are trying to get OES in their communities, but they're experiencing challenges?
So one of the things I often say, and Eddie's kind of given an example to this, is that you are the local expert in your community. And so you know best how to talk to the folks in your community and what they're interested in. And so like Eddie says, a lot of it is stepping into that space and trying to find out what the needs are in your community that you can help meet. And the OES really is there to support you with doing that. And so whatever challenge you're experiencing, we encourage you to call and talk it over with us. We're always here to help, to provide information on how it works, to provide information on what to do with the results after you've collected them. And there are some resources and videos that are available on our website to support that as well. And we have a partnership with Ohio University and Pacific Institute for Research and Evaluation to continue to help create some of those toolkits to help discuss how to use that information and to develop those sample MOUs and put those up on the website. So whatever assistance that you need, we will find you a way to get it, whether that's connect you with someone like Eddie or connect you with some of our other resources throughout the state. So no matter what your issue that you're identifying, give one of us a call and we'll go ahead and see what we can do to help.
So to echo what Laura was saying, something that I want to share to help others is to leverage the relationships that you already have. I think sometimes when we have one goal in mind, we go in really strong with, hey, this is the one thing that I want to present. But what's worked well for us is, hey, are we in that school doing youth ed prevention? Are we doing life skills? Do we have a relationship, a partnership in another capacity? And just really leveraging those relationships. And then something else is just crosswalking those things. Haley and I do the Bob and life skills trainings. And just this past week, we was able to go ahead and talk more about the OHYES survey and youth-led prevention and other things. And one of the feedbacks that we got from that training was just the fact that people felt that we was real, that we was comfortable, that we was easy to talk to. And I think when you come off as just that transparent, real, comfortable champion for the community, I've found that most superintendents, administrators have a wide open door. Once they realize that you're there to help their students, you're there to have that positive relationship. And, you know, even mentioning that PBIS, mentioning that SEL component, mentioning those things that you can help them with, and then just using those current relationships. And I just think that sometimes we overcomplicate the process when we can just use those little conversations, those little pieces, find those champions, and then work through that process.
Thank you so much, Eddie and Dr. Bellison. And it's time for us to land this plane. I really enjoyed this conversation about Ohio's Healthy Youth Environments, or OHYES survey. But before we do, I want to make sure, is there any other last information you think our listeners should get about the OHYES before we end today?
I guess I'll say there's no wrong door. So reach out to someone and ask them how it worked in their community. Reach out to Eddie. I have some other folks I work with that if you want to know how it worked in their community and some tips and tricks for them, reach out and we'll find a way to get you that help.
Holly, I would say that a little bit of smoozing goes a long ways.
Hear, hear.
Well, thank you so much, Dr. Bellison, providing that state perspective on the OHYES, and Eddie for being a community leader who is putting the OHYES into practice at the local level. Know that our Ohio Adult Allies listeners and anybody else who stumbles upon this podcast here in Ohio will find this very interesting and will support their work. Until next time, audience, we wish you the best with you and your young people, and thank you for your service to the mental health promotion and substance use prevention in Ohio.
Thank you for joining us today on the Ohio Adult Allies podcast. If you would like more information on our work, visit us at ohioadultallies.com. You can find more episodes on Spotify, iTunes, and other platforms by searching Ohio Adult Allies.